Welcome to the Education on the revised Infection Control tab for the Admission Assessment and the Daily Assessment. The objective of this educational activity is to relay the information on the updated version of the Isolation Precaution Policy. It is integrated in the electronic documentation through the Infection Control tab in Clinical Care Station. Also included in the Infection Control tab are documentation standards from the Tuberculosis Control Plan Policy and the MRSA Active Surveillance Testing Protocol. For a more detailed information on these policies, please refer to the MCN Policy Portal. To begin, we will review the Infection Control tab in the Admission Assessment. We will complete the documentation with an example of a patient admitted with signs and symptoms of tuberculosis from a correctional facility or the local jail. In the Care Gland screen, bring the patient into focus by highlighting the patient on the screen. Double-click on the AA bubble to open the Admission Assessment. Select the Infection Control tab. This is the revised Infection Control tab. Before we proceed, one functionality worth knowing is called Reference Information. It is found when you right-click on the title of an assessment group. Reference information associated to an assessment group contains part of a policy pertaining to the assessment findings or the interventions. Reference information also can be found containing from textbooks or evidence-based articles that help support your findings or interventions. It is important to note that not all assessment groups contain reference information. To begin, select the findings from your admission assessment. When you reach to the assessment on ordering for positive screening for tuberculosis, you can refer to the reference information to find supporting details to your assessment findings. Notice that what is contained in the reference information are information from the Tuberculosis Control Plan Policy. Continue to assess for other active infections, additional precautions, or any history of multi-drug resistant organisms. Moving to the screening for MRSA. Notice that prior to the screening, a statement is presented on top. The statement is referencing to all those criteria below that any of this type of patients below identified will meet MRSA protocol. Since our patient is from the local jail, we will select that assessment finding. To find supporting information regarding this assessment finding, right-click on the title of the assessment group and select Reference Information. Notice that if the patient is from the jail or skilled nursing units, patients must be placed on isolation and also be screened for MRSA and decolonization if positive. This is in according to the isolation precaution policy. Notice that your findings have orders tied to them. So when you complete your assessment, and close them, an order will be generated. When an order is generated from your findings, before you exit your assessment, a caregiver search pop-up will occur. You need to enter the ordering physician to complete the orders. When entering a reason or an indication for this particular order for the infection control consult, select the search tool on the right side of the box. In the indication function, the tab called Common Order Indication will have pre-selected conditions for you to choose from as an indication. If they do not apply, you can click on the Search tab, type in the few letters of the indication, such as in this case, tuberculosis, selections will be available below. Highlight the ones that is the appropriate indication, and it will move to the right. Click Save. It will now populate in the reason and indication box. Click OK. This is the order for the MRSA protocol. Because our patient meet criteria for MRSA protocol, that particular finding has triggered the MRSA protocol order. Click OK to submit. Now you've completed your admission assessment and you are back on the care plan screen. Refresh the screen. Click on the intervention or the action list. Notice that your assessment findings connected to an order or set of orders are now in your action list. To keep your action list accurate, when these particular orders or duties or tasks have been done, set them as complete, check them, and refresh the screen. Notice that they are no longer in your action list. Working from the same scenario, we will now review completing the infection control tab in the daily assessment. Bring the patient into focus in your care plan screen. Click on the Perform Assessment icon. Select Daily Assessment. Focus to select the Infection Control tab. Continue your assessment. Earlier, when we performed the admission assessment, we ordered and obtained a culture swab for MRSA. Granted, in this situation, that the culture came positive, we will now initiate the MRSA decolonization procedure. Reference back to the reference information and according to the isolation precaution policy, as well as the MRSA protocol policy, this particular patient scenario, when positive for MRSA, we need to proceed for the MRSA decolonization procedure. In this case, we will now select the finding for the nasal culture result and proceed with MRSA decolonization. Again, this finding has an attached order to it. When we complete our assessment and close it, the Caregiver Search tab or pop-up will occur. Before the order is completely submitted, we need to enter in the ordering physician. Review your action list. Notice that on the once frequency, your decolonization procedure order is in your action list. In the decolonization procedure, you have submitted the order for the chlorhexidine 4%. For the mupirocin order is a conditional order. The nurse must enter into CPOE and order mupirocin 2% ointment BID for the MRSA decolonization procedure. Having this as an order or in your action list is not adequate. An extra step has to be done, which is to order mupirocin in CPOE. Once all these orders have been executed or completed, on the mode button below, set it as complete and refresh the screen. Notice that they are no longer in your action list. Continuing with the scenario, in your daily assessment, after you ordered the decolonization procedure, now you are ready to document the actual intervention to that procedure. Focus on the patient by highlighting the patient information. Click on the Perform Assessment icon. Select Daily Assessment. Focus and select the Infection Control tab. Scroll down into the screen and perform the documentation for your MRSA decolonization. When you select as part of your assessment and part of your intervention to apply mupirocin 2%, that finding will pop a secondary finding, which is to identify if you have intervened or acted on it on the first day, because such order requires to be done for 5 days. The same thing will happen for chlorhexidine. You can also add additional documentation by right-clicking and selecting a group note to add more details to your intervention. When done, you can yellow arrow back to close your assessment. This completes the education on the revised Infection Control tab for the admission assessment and the daily assessment.